Hello and welcome. So today's topic is our middle layer of the eyeball, which is also known as vascular coat of the eyeball, which is also known as uveal tract. Now it consists of from anterior to posterior iris, ciliary body and choroid. Now first of all iris, as you can see in this photo. This is the colorful structure of the eyeball, which you can see from the outside. In front of mirror, or you can see someone else, or even you can see mine, that the color of my iris is black. Some people have brown, some people have blue, green and lots of colors. So this thing depends on the genetics, ethnicity, geographical location. Okay, anyway, so coming to the main point. Now as you can see in this photo, this is the circular disc and this is the iris of our eye or eyeball. Now at the center of this circular disc there is a hole. Same to same, at the center of the iris there is a hole. This hole is known as pupil and the average diameter of this pupil is almost 4 mm. Now this hole can dilate, even it can constrict. Now how much it gonna dilate it and how much it gonna constrict, this thing depends on the clinical condition and person to person. Now understand one thing, this entire iris we divided into two parts. One is ciliary zone and pupillary zone. The part of the iris presents near to the ciliary bodies, we call it ciliary zone, and the part of the iris presents near to the pupil, we call it pupillary zone. Simple. In between the ciliary zone and the pupillary zone, you are getting zigzag line. Okay, this line is known as collarette or the collarette of iris, and this pupillary zone extends from this collarette of iris to the pupillary frill. As you can see in this photo, the margin or the boundary of this foramen is known as pupillary frill. Okay, now the microscopy of this iris. First of all, we are getting the anterior limiting layer. This layer consists of melanocyte and fibroblast, and it is the most condensed part of the iris. Okay, so one extra knowledge point for you, that in case of blue colored iris you are getting very less amount of pigments, and in case of brown or black colored iris you are getting condensed amount of or maximum amount of pigments in this iris, or these pigments are present only in this anterior limiting layer. That's it. And the second layer is known as the stroma of iris or the iris stroma, which consists of dilator pupillae, constrictor pupillae. This constrictor pupillae is also known as sphincter pupillae. Okay, now this constrictor pupillae or the sphincter pupillae is a circular muscle bands, and maximum amount of number presents in the pupillary zone, then the ciliary zones, and it is supplied by the parasympathetic branch of the oculomotor nerve. And then you're going to find the dilator pupillae muscles. These are vertical or radical muscles present in the ciliary zone of the iris, and it is supplied by the sympathetic branch of cervical sympathetic plexus. And then you're going to find anterior pigmented epithelial layer, which is basically the continuation part of the anterior pigmented epithelium layer of the retina. And then you're going to find posterior pigmented epithelium layer, which is basically the continuation part of the non-pigmented epithelial layer of the retina. Now the ciliary body, as you can see in this photo, this is basically the continuation part of the choroid at ora serrata. What is ora serrata? We'll talk about later, not now. This ciliary body has anterior rough part and posterior smooth part. Anterior rough part is almost 2 mm and the posterior rough part is almost 4 mm. Now this ciliary body consists of ciliary muscles. These ciliary muscles have longitudinal fibers, circular fibers and oblique fibers. These longitudinal and oblique fibers acts for aqueous outflow, and the circular fibers acts for accommodation. What is accommodation? We'll talk about later, not now. And now the third part is choroid. Choroid, now as I said, iris, ciliary bodies and the rest of the entire middle layer of the eyeball is known as choroid, as you can see in this photo. It is very vascular, has lots of blood supply and extends from ora serrata to the optic disc. What is ora serrata? Optic disc we'll talk about later, not now. In the microanatomy of choroid, it is consist of basically condensed collagen fibers, melanocytes and fibroblasts. And then stroma of the choroid, which consists of loose collagenous tissue with very minor amount of elastic and some reticulin fibers. And thirdly, you're going to find basal lamina. which is also known as Bruch's membrane or Bruch's membrane, whatever you're gonna say, you can say, it doesn't matter. The blood supply of the choroid, it is getting supplied by the anterior ciliary arteries, short and long ciliary arteries, and 4 vortex veins. These are actually supratemporal, infratemporal, supranasal, infranasal. So this is all about a brief video about our uveal tract or middle layer of the eyeball or vascular coat of the eyeball. I hope you will understand, and see you soon in my next video. Till then, bye.